Hi, my name is Olivia Parker, and my presentation is on the impact of eHealth Exchange on patient care, delivery, and networking. eHealth Exchange provides to the access and availability an individual has to facilitate healthcare over state lines. Now for electronic health information exchange. The exchange of health information not only provides a patient with having access to their own care, yet providers being able to access the health records and history through information exchange. So this can be shown through patients' data being recorded, patients' medical history as well, which then allows for a provider or a clinician to then see that information through the exchange of that information. Hospitals' engagements in all four domains of interoperability, send, receive, find, and integrate increased from 46% in 2018 to 70% in 2023. And that's over a 52% increase. And that was my data from about 2 years ago. And since then, there has been more technology advancements, one of the main ones being AI, as we all know of. So there has been more advancements within that, how I recorded mine from 2018 to 2023, which I think was a good period of time due to COVID-19 and also advancements within technology and society as a whole. Exchange of information allows providers with the full medical history. This can also reduce errors and promote decision-making regarding a patient's health outcome and diagnosis. So within this figure that you see, so this is the percent of U.S. non-federal acute care hospitals engaged in interoperable exchange of health information from 2018 to 2023. And as you can see, there was that 52% increase in that data regarding how the information is sent, then received by a health organization, and then how it can be found if it's able for a clinician to view it, how easy it is to view it. If it's in a secured file, it should come over in a secure file, and how they then can find that patient information, and how they then integrate that within the concerns or questions that a patient has when deciding an outcome and addressing those concerns, which would best be available for the patient to see. And that also leads to interoperability, how we then take in that information, which we are receiving to come to a desired outcome from decision making. Why cross-state eHealth exchange is beneficial. The exchange of health information across state lines. HIE is critical by allowing healthcare providers and clinicians with the correct resources to examine a patient's health data and medical history to address a desired outcome. HIE has been very helpful when it comes to recording data, having data from one organization, then being able to securely and safely come over to another to then have that data in front of you rather than maybe having that unknown of what a patient has already had done, or if their records haven't even been recorded. Many critical components within the eHealth exchange provide support to the implementation of the HIE across state lines, including EHRs, which are electronic health records, EMRs, which are electronic medical records, telehealth services, MyChart, and other secure electronic platforms, as the example of MyChart. These resources are very important within society today, and especially in the United States and how we view healthcare. Regarding telehealth services, and I will highlight on COVID-19, that was a big thing where people were able to see their provider, get their questions addressed due to that critical part in time. And this also provides a stable option for people that may not have transportation to get to their appointment, may have questions or concerns, but their day-to-day routine doesn't allow for them to go see their provider. And this then allows for a patient and provider to connect directly. These resources provide to eHealth Exchange across state lines by providing patients and providers with the correct tools to view and assess patient care. Trusted Exchange Framework and Common Agreement, which is known as TEFCA, TEFCA. The TEFCA aims to safely exchange electronic health information across healthcare lines, which was established within parts of the Cures Act. This also strives to promote the exchange of healthcare information data across state lines by promoting collaboration and communication between health organizations across healthcare, aiming to provide the quality of care. And I will highlight on quality of care is very important rather than the quantity of care. Quality of care really strives to have a person's care be the main aspect, seeing what they need, how can their questions and concerns be addressed rather than the quantity of care is doing as much as you possibly can to address a concern, which then that leads to rising costs where quality of care really strives to see what is in need for the patient, could include a certain diagnosis, medication plan, therapy, and also maybe x-rays. There are multiple diagnoses that really strive more for the quality of care rather than the quantity of just doing all these tests when they may not even be needed. This also allows support to nursing informaticists by improving patient care, reduction of costs, and reducing errors due to lack of information on hand. I will highlight on health informatics is crucial with this by gathering that data and information and seeing how we can improve from it and also evaluating what is still needed. And this is great for nursing informaticists because the nursing individuals are at those front lines seeing the care and providing that care as well. And the informatic part about that is also evaluating how it can be improved, how then that data can be used to benefit the patient. And also, this can be shown within population health as well. eHealth exchange across state lines promotes patient care, delivery, and networking through data that is securely shared from health organizations, contributing to the overall health and well being of a patient and the resources that healthcare providers and clinicians have to effectively determine a desired outcome for a patient. Allowing for patients to address their care from where they are without the fear of not being able to connect with their provider and have their history visible when being treated. So my argument here is that eHealth exchange is crucial amongst state lines and something that is still being developed and seeing what more we can do. Because one of the fears that a lot of individuals may have is even if they're in their own network regarding their healthcare plan and insurance. And that is one thing that individuals should be educated more on is where can they have their healthcare be addressed? And if they are out of network, is there a way for them to still be able to connect with their provider and also having those records still be visible even if they're in a different state or if they're in a few cities away and they maybe don't have a certain hospital or clinic that is in their networking, but how their data and medical history can still be visible to that provider, which ultimately will allow for a patient to be correctly examined and for the correct diagnosis to be declared as well. And these are my references I use within my presentation. Thank you for watching, and I hope to learn more about this subject and how we can still improve eHealth exchange and see where this can go across state lines relating to patient care and how information is exchanged. Thank you.